Good afternoon, everyone. I'd like to introduce our guest for today. His name is Patrick Brodigan, and he's with Marion County Health and Human Services. His topic today has to do with loneliness and isolation, which a lot of us must be feeling right about now. Patrick, I'm going to let you tell us a little bit about what you do and how we got together. And at the end, there'll be time for some questions. Take it away, Patrick.
Thank you, Darlene. It's so nice to be invited here to talk at the Silverton Senior Center. I'm a Marion County resident and I work at Marion County Health and Human Services. My role there is the older adult behavioral health specialist. I'm one of 24 specialists across the state. And, I'm not going to spend a lot of time talking about that, but one of the core things that we do is community health education. So that's kind of what we're doing right here today. I was invited by Dodie to come and speak on the topic of loneliness and social isolation. And so here I am, and I'm really happy to be here, Darlene. Thank you so much. I've got a PowerPoint. I think I'll just launch right into it, and we can get started. There's that first slide, talking about loneliness, social isolation, and older adults. So first, a few acknowledgments and appreciations. Dodie Brockamp, Executive Director of the Silverton Senior Center, and Darlene sitting in today, helping out. I really appreciate this. I also want to thank Marie L. Jennings. She had also had some slides on loneliness and social isolation that Dodie asked me to integrate into today's presentation. And so I did that because some of that information was really vital stuff. Like I mentioned earlier, I'm with, my role is the older adult behavioral health specialist. And as part of the older adult behavioral health initiative that I mentioned, there's the website. I encourage folks to go there, www.oregonbhi.org. A lot of cool things happening. We've been around since the spring of 2015, and it's a pretty cool initiative that the state rolled out to help with health system change. And I'll just leave it at that because there's a lot to check out. I also want to give a shout out to the Campaign to End Loneliness. This is out of England. They've been around for a while. And in fact, the Campaign to End Loneliness inspired some of my colleagues with the Older Adult Behavioral Health Initiative to really start looking at loneliness and social isolation among older adults and what we can do as communities to address that. Also, John Cacioppo is he's passed on, but he's a pioneer. He was a pioneer in the area of research into loneliness and how people need to have social connection, right? That's a very simplistic kind of explanation, but he pioneered this research and a lot of the concepts that I'll be talking about today. I wanted to make sure that I recognized Dr. Cacioppo. He was working out of the University of Chicago. So what is loneliness like for older adults? At this point in my presentation, we would have run like a video, but time constraints being what they are, we're not gonna look at the video. It was produced out of England, basically interviewing older adults and expressing their firsthand experience with loneliness and social isolation. So we're diving into loneliness defined, right? So loneliness is the subjective feeling of being alone. It's very personal and it's unique to each individual. It is the distress that results from discrepancies between ideal and perceived social relationships. So people have this personal kind of feeling about what an ideal relationship and what they perceive their social relationships to be. And it's that tension or that stress between those two conflicting things. Social isolation, on the other hand, is a very different animal. Social isolation refers to a complete or near complete lack of contact with society. And this relates to the quantifiable or the number of social relationships. You can actually count your social relationships to determine, are you struggling with social isolation or not? So, and as we get into this further, those two concepts will become more clear. So what do older adults say about loneliness and isolation? Those videos, and they'll be posted on your website, so you can look at those at your leisure. But again, it's about interviews with people actually struggling with loneliness and how they define it in their lives. And what you're going to see in these videos are individuals from the United Kingdom. So they have, in some cases, pretty thick British accents. So what are some of the risk factors around loneliness? So being widowed or divorced, reporting poor self-related or self-rated health, like if you have a health problem and you report that and it's growing over time, you're at risk of loneliness because of the kind of retreating from society with dealing with a health problem. Sensory impairments, so hearing and vision tend to isolate people. Disability impaired mobility, of course you can imagine if somebody is in a wheelchair potentially and they are scared about going out in the community because they might not have access, or maybe they have mobility issues that cause anxiety around just being able to walk, they might stay home, and that's a risk factor for developing loneliness. And then of course, finally, time spent alone is a risk factor. So the more somebody is just spending time alone, they might over time develop loneliness. And here's a graphic that kind of has the intrinsic, so those things that are natural and about us personally, our social group membership, our personality traits, maybe psychological responses. So it's these intrinsic, those free bubbles at the top in blue, they're kind of personal to us. And then there's an intersection with what are called extrinsic, so things that are outside of you, personal circumstances, environmental factors, and then life events, traumas, or transitions. Examples of that might be somebody that has to move from their independent living where they were close to their friends and they never had a problem with loneliness, and now they have to maybe move to an assisted living facility. They have to transition because they need more support, and their social network is now, it's broken, hopefully temporarily. But as you can see, that external event can lead potentially to loneliness. So it's important to note that loneliness is not depression. So according to the Mayo Clinic, depression is defined as a mood disorder that causes persistent feelings of sadness and loss of interest and pleasure. It affects how we feel, how we think, and how we behave. And it can lead to a variety of emotional and physical problems, including difficulty completing your daily tasks and feelings of worthlessness. Now, we want to make the differentiation between loneliness and depression. Loneliness is a major risk factor for depression. So the more somebody struggles with loneliness, the more that they could develop a serious depression and feel those symptoms of a depression. So we should talk a little bit about loneliness and the risk of Alzheimer's disease, because it is very serious and sobering. So research shows, as you see in the slide, that the subjective feeling of loneliness is a risk factor for developing Alzheimer's disease. Feelings of loneliness are linked to poor cognition, performance, or poor cognitive performance and quicker cognitive decline. And people who reported being socially isolated but not lonely were not at an increased risk of developing Alzheimer's disease or another dementia. So that's that last bullet is, it gives hope. So, and it's also sobering. So you can be socially isolated and not be at risk of developing Alzheimer's, right? So you might live alone, you might be an introvert, you might be very comfortable with how you spend your time apart from others, and you're not going to necessarily be at risk of developing Alzheimer's disease. Loneliness, on the other hand, is a direct risk factor. And this was taken out of a research study a while back in the magazine, a Journal of Neurology and Psychiatry. So pretty important things to consider. Let's talk about living with Alzheimer's and loneliness. Most everybody knows from what they've been reading in the news and maybe their experience with people in their network or loved ones or relatives, that when someone develops Alzheimer's disease, their ability to connect with the world, the outside world, changes dramatically. The challenges of caring for someone with Alzheimer's disease differs from caring for someone with other diseases like cancer or diabetes. And just something to think about. What do you think makes the difference, makes that different? How might these differences affect the loneliness of a caregiver? So just take a minute to think about that. Somebody who's having to caretake for someone struggling with Alzheimer's, as they retreat further and further into that dementia experience, where they have difficulty concentrating, difficulty with their memory, difficulty communicating, and how is that relationship with that caregiver going to be strained and challenged? It's very important to understand that in the world of Alzheimer's caregiving, that a caregiver is at greater risk, because if they're spending the most of their day caring for a loved one with Alzheimer's, they're not going to have the same ability to connect with that person. Like I mentioned earlier, the communication is going to be very impaired from the person experiencing Alzheimer's, and the caregiver is naturally going to feel frustrated. They're naturally going to feel kind of isolated. And so that tends to happen in the latter stages, the middle and the latter stages of Alzheimer's disease. It's just something to be attuned to as far as the world of loneliness and how caregivers are impacted. Here's some other risk of loneliness and isolation, some statistics that AARP put together. Nearly 1 in 5 adults over the age of 50 is at risk of social isolation, and that came out of the Connect to Affect campaign that AARP put out. Loneliness is as dangerous as smoking 15 cigarettes a day. That's the Holt-Lunstad study from 2010. That's really sobering, and it's almost kind of mind-blowing, but that's what they found. Loneliness is associated with high blood pressure and heart disease. And you can imagine that as people struggle with loneliness, that anxiety and depression, but the anxiety and worry tend to go up. So we see those kind of physiological effects of loneliness. And then finally, the subjective feeling of loneliness can increase risk of death from 26 to 45%. And those are pretty sobering statistics as well when we're talking about the risks of loneliness and isolation. So these next few slides are very serious because it deals with the topic of suicide among older adults. And the reason why this is here is because of the risk of developing a depression when a person is struggling with serious loneliness. And we want to be attuned to the fact that with some adults, serious depression can have a risk of suicide, death by suicide, associated with it. And that's why we talk about this serious topic right now. In Oregon, 93% of older adults who died by suicide in 2014 had a chronic illness. So with chronic illness, a lot of times, comes pain, and a lot of times comes social isolation, especially if it's a chronic long-term illness. And by the way, these statistics are from the public health component of the state of Oregon. So it has been estimated that 15% of adults over the age of 65 suffer from persistent and serious symptoms of depression, but only 3% are given a clinical diagnosis of depression. In one study, 75% of physicians were found to believe that depression in older persons is a normal fact of aging, or a normal fact of old age. And that was really shocking. And part of the Older Adult Behavioral Health Initiative, when we do our work, is to incorporate health system change. We are dedicated to addressing that kind of a shocking statistic with primary care and making sure that we do trainings and we do education so that when an older adult goes into a primary care visit, which is a normal part of where they go for medical care, that doctor is going to understand more about what the struggle of an older adult is, and that it's not necessarily being condemned to depression. That's not a normal part of aging. That last bullet is a bit thick, but to summarize it, there are programs out there that reduce the certain risk factors, such as depression, social isolation, loss of a spouse or partner, access to lethal means. When you put those kind of like factors coupled with increasing protective factors like social support, coping skills, and outreach, you can definitely have an impact on lowering death by suicide in older adults. So it takes a pretty concerted effort, but it's possible with the right combination of supports. So zero suicide, the Zero Suicide Initiative, which is happening across the country, and in Marion County, our health department, or what we call Health and Human Services now, has a Zero Suicide Initiative. And I welcome folks to go to the Marion County website and go to Health and Human Services link and check out what's going on with zero suicide. It's an aspirational goal, but we want to address suicide prevention in a very concerted effort, in Marion County. And these statistics bear out how serious the issue is. In the month before an individual's death by suicide, half of those people saw a primary care provider. 30% saw a mental health professional. The risk of suicide is highest in the first 30 days following discharge from an emergency department or an inpatient psychiatric unit. So these kind of statistics are very sobering, and it's just worth drawing attention to how serious these issues are, and the role that loneliness plays in, like I said earlier, leading potentially or putting people at risk of developing a serious depression. So how does loneliness impact suicide, the behavior or the suicidality? Two components of thwarted belongingness are loneliness and then the absence of reciprocal care. So those are relationships in which individuals both feel cared about and can demonstrate care to others. There's also a perceived burdensomeness. So a person who's lonely and also has thoughts of suicide feel that they are defective or flawed to the point of being a liability to others. They're a burden to other people. So that's also connected to loneliness. Suicide prevention in older adults is fairly straight ahead, but it takes a fair amount of effort. So providing for purpose and meaning in life as people get older and they transition out of work and their families grow up and move away, older adults need to find purpose and meaning in their life to be able to combat or to lower that risk of suicide, and also lower the risk of depression, and also address loneliness. Consistent and meaningful connection to people is very important. And we'll talk more about the role that COVID-19 is playing and a kind of an impact on our ability to have consistent and meaningful connection with others. The next bullet, asking the question, are you thinking about suicide? Do you have a firearm, a plan? So even though this is real serious talk, it's necessary to break down the barriers in those conversations when it comes to somebody thinking, oh, this individual that I know, they've been struggling with loneliness and depression. They have guns in the home. You know, I haven't seen them in a few days. I better check in with them and see how it's going. They might even have an alcohol problem or something else that's a risk factor. So that's why we ask these tough questions, and you know, they are very important. The next bullet, restricting access to means. So when we talk about lethal means, firearms and other ways that somebody might end their life. And then we need to know who to call for help. And at the end of this presentation, I have some resources that we'll go over in detail. Here's an example of a loneliness scale, and this is from Psych Central. It's the websites there listed at the bottom. It's a real simple kind of self-evaluation tool that basically scores people at 9 or higher. Will equal more loneliness, a higher degree of loneliness. So, and that's a very simple kind of, it's 3-question, I feel left out, I feel isolated, I lack companionship. So a very simple and straight ahead type of test to take or administer. So let's talk about some prescriptions for loneliness. So what can we do to prevent loneliness? Excuse me. So with COVID-19 in mind, we have to focus on, being the connection. And what do I mean by that? So especially in this time of COVID-19, practicing open, friendly communication is more of a challenge with people having to wear face masks. We're going to talk about Zoom calls, that course that we're doing right now. Because in the old pre-COVID days, I would have come out to the senior center and given this talk in person to a bunch of people in a room with smiling faces and able to have an interaction. So right now, being that connection, we're going to have to use more creativity to make that happen. The next bullet there, schedule regular face-to-face visits over Zoom with family and friends. And if you don't know how to use Zoom, this is a time to call somebody, maybe somebody younger than yourself. If you've got somebody in your network that maybe even can link you. Some of the senior centers I know have more sensitivity to some of what we call the digital divide. So access to technology to keep people connected. And that would be a good question for Darlene and Dodie to talk about that there at the Silverton Senior Center. The next bullet, get to know your neighbors, look for opportunities to cultivate connections. Again, we have to do that safely, of course. Don't forget about yourself. Examine your habits. Exchange solitary activities for safe social activities when you can. And I know from going to the Silverton Senior Center website, they have a very robust schedule of keeping people involved during one of the most challenging years that I can remember, 2020. It's probably been worn out, right? But it's a kind of a historic year for challenging all of those things that were kind of patterns of our life, including our social patterns, how we connected with others. So anyway, I'm probably not telling anybody out there something they don't already know, but it's worth repeating. I also want to encourage people to follow all the safety guidelines that were enacted by Governor Kate Brown through the Oregon Health Authority. The website link is there for guidelines around social or safe social activities. And there's a lot of interesting ideas on how to make a social activity safe and protect everybody's health. So here's some more information from John Cacioppo. This mnemonic, EASE, EASE, is kind of a neat way to remember what to do to address loneliness and social isolation in your world. And we're going to go through each one of the letters, the E, A, S, and E here with these slides coming up. It's kind of a cool way to develop a plan, and it's easy to remember. So the next is extend yourself. Do you have a talent, a special thing that you do that you can share with others? And the examples here, knitting baby blankets for local nonprofits that serve families. There's a very wild hat. You know, maybe you have other types of crafts that you do that you can share with others. More extend yourself. You learn about Zoom calls. We just kind of touched on that. Maybe you have to ask your grandkids to show you how to watch a chair workout via Zoom or YouTube rather. Next is the action plan. We all make jokes about not knowing what day it is. And now is the time to go back to planning out your week, especially with COVID-19 and, you know, the need to kind of, like I kind of referred to earlier, address those patterns that have been disrupted due to the pandemic, due to the wildfires, due to whatever, and just get back in the habit of having a plan and getting into your calendar is a good picture there to start having things to do, keeping busy. Like exercise, unless we plan for it, make a personal connection, it's not going to just happen on its own. And that pretty much goes without saying. Mm-hmm. So what if somebody is already lonely? What can you do? So you look for ways to support the individual. You want to proceed with empathy, being sensitive to that person's situation, knowing that loneliness hurts. It's that subjective feeling that we have internally. It's personal to each individual, and we want to be sensitive to the individual's feelings and their perceived reality. And again, with the introduction of yourself to an individual you're wanting to approach, of course we have to do that with COVID-19 in mind. We want to practice active listening. That means listening to that other person and allowing them to really speak freely and not trying to make yourself the story or the topic, but really letting that individual who you think is struggling with loneliness to tell what's going on with them, to really talk. And you just make great eye contact. If it's over Zoom or even on the phone, you're going to be going, I hear you. You know, you're going to be giving that validation for that person. Let silence happen. The feeling of loneliness can be so deep and so painful for that individual that sometimes it's just a good idea to sit with that person and hold space for the struggle that they might be going through, as it's a very tough time. And then the last bullet there is to be aware of your body language and the tone and volume of your voice to kind of match that person's tone and volume. And it's about validating and kind of sitting with that individual and being respectful of what they're going through. So the next part of the action plan is to seek the collective. And research shows that is not the quantity of relationships, but the quality of social relationships that matter. You want to look for connection in places that you will find like-minded friends. And the example there is to start with a virtual lunch with Dodie. It's also a good idea to reach out to your local senior center or faith community. These are places that, as everyone knows that's probably watching today, are vibrant, places. Even if we're doing a lot of things online, there can be a lot going on. So to reach out and seek that out. Some people remember the use of pen pals, and in the in a day not too long ago, most everybody wrote letters. Now, a lot of people are using email, but if there's a pen pal program in your community, you should try to join it, you know. And if there's not, the challenge is to why not start one, you know, just to get people into the habit of connecting with each other, even if it's over an email or writing a card, sending a card through snail mail to somebody. It can be, receiving that is a great thing. Under the Zero Suicide Initiative, we have what are called caring contacts. So this is based on some research that was done by Ursula Whiteside out of the University of Washington. And the goal of the caring contacts is to reach out to somebody and just let them know you care. Now, and not expecting anything back, and not telling somebody, hey, you know, call your grandchild, you know, not giving advice, just telling somebody that you care and that you're thinking about them. These caring contacts have been known to help people that are really struggling with serious thoughts of suicide. And so all the more better that if somebody's struggling with loneliness, receiving a caring contact would be a good thing. So expect the best. Social contentment can help us to be more consistent, generous, resilient, and optimistic. And lastly, that expect the best attitude helps us project our best. So when we expect the best from us, we're going to show that to the world. And that's really what it's all about. And there's a quote over there about the greatest weapon against stress is our ability to choose one thought over another. So some of you have probably heard about the power of choice. So the power of choice is that's something that we all have. And we get to choose how we respond to things. We get to choose how we think about things. And rather than being swept up in different, you know, either negativity or the latest crisis, we get the opportunity to stand back and make a choice, and a real mindful kind of choice. And some of you probably are aware of the whole concept of mindfulness and self-awareness. And this is kind of where that quote comes from. So what doesn't work? So research out of the Biomedical Center for Geriatrics has determined that getting a pet is not going to alleviate loneliness. And this is especially true in men. And that kind of surprised me, actually, because of, I guess there's been a lot of work about, you know, connecting people to pets and things like that, especially companion pets and things like that. So this research or this study kind of flies in the face of that. And to be honest, I haven't dove into that study and really tried to sort out for myself, you know, why was there so much push to people have pets, and then of course, you know, this study kind of being in conflict over that. But if you want to go to the Biomedical Center for Geriatrics and look up that study, I definitely would encourage you to do that. It kind of started my mind working. Now we're going to talk a little bit about resources that you can utilize to address loneliness where you live in your community. So the Friendship Line is kind of the gold standard of support lines and hotlines for older adults. So this was started by Dr. Patrick Arbor back in the 70s, and he has dedicated a big part of his life to combating loneliness in older adults. And this Friendship Line is accredited by the National Suicidology Group as a very, very tried and true and research-based and professional resource for addressing loneliness. They have a call-in service, and that is it's free. It's for anybody. Their call-out service is restricted to the pretty much the Bay Area in California where they work out of. Anyway, there's their contact information, a very great resource at kind of a national level. But it's a 1-800 number, so it's open. Here's some local resources. So I put the Salem Center 50 Plus on here because they have a friendly caller program where they call out to people that are isolated and might be struggling with loneliness. It's staffed by volunteers, and some of you might already know about that. The Friendship Brigade, before COVID, they were doing a lot of reach in to nursing homes and memory care units and so forth to address loneliness, making planned visits to some of these facilities where older adults might be struggling with loneliness or even social isolation because they can be around people, but they might not feel connected to people, as you can imagine. The next bullet is Northwest Human Services. They have a crisis and information hotline. They've been around forever. They used to be called the Cry of Love, and they've been around since the 70s as well. And then I've got Marion County Health and Human Services Psychiatric Crisis Hotline or Crisis Center, and they're a 24-hour, 7-day-a-week walk-in and call-in resource for people undergoing a mental health crisis. Here's some additional resources. That top one, the Dave Rompery Oregon Warm Line, that's been around for a while. Then you've got the Oregon Health Authority Senior Loneliness Line. After that, it's the SAGE LGBT Elder Hotline. And then I put the Silverton Senior Center there with their web address, the Northwest Senior Disability Family Caregiver Support Group, a really incredible program, working with older adults and family members that are caring for loved ones with serious chronic illnesses, some of which are Alzheimer's and some of which are other types of physical illness and disability. And they offer monthly support groups for family caregivers, and that's open to the public. We have currently 3 family caregiver support groups operating in Marion County right now. One is for the rural Marion County, one for Salem, Kaiser, and then one in the southern part of the county. I've got Project ABLE. So that's a peer-run organization. They have a call number, or it's a friendly call number that you access right there. And then they are offering some internet-based activities for people that are isolated right now because of COVID-19 and not able to have social, visits with people. So Project ABLE took some of these activities, brought them onto the internet through their website. And so those are kind of neat things, a way to keep people kind of connected. Here's a listing of all the senior centers in Marion County. And most of these people in the audience probably are already very aware of. The Canyon Senior Center, obviously right now, because of the fires in the canyon, I'm pretty sure it's closed down. I'd be surprised. I know that the SIT mobile group is doing a lot of work in the canyon to address some of the serious needs up there, getting food to people, clothing to people, prescription medications to people. It's a very necessary resource. So the canyons, of course, is under an incredible challenge right now. I put their senior center there. And then the last video is an inspirational kind of a video. We'll try to get that downloaded or uploaded to your website with a link so you can watch that at your convenience. That'd be great. And then there's my contact information for you all as well. And Darlene, I think I covered just about everything there.
That's awesome. Really good information. So thanks for your presentation today.
Yeah,
I would
you're
look
welcome.
forward to Really glad we connected with you and look forward to working with you in the future.